Hello, everyone. Welcome to COVID Corner. I'm Tony Leon, your host. This is the place where you'll be enlightened, encouraged, and empowered to take back your health during this pandemic worldwide crisis. We're going to get right into our program, but before we do, I'd like for you all to consider subscribing and hitting that notification bell if you haven't. I'd like for you to like, share, and comment. And let me focus on share. See that symbol? That little arrow? When you see that on this YouTube video, please copy that link and share it with all your contacts, social media, what have you, because this is very important. And I'm trying to share this with as many people as possible because time is running out. We're in a crisis. And today's title is Vaccines, Variants, Omicron, the Good, the Bad, and the Ugly. And this is basically you getting the other side that you haven't heard. Most of this information is basically going to be me conveying what other authorities have went over, but me dissecting it and telling it in such a way where it creates this narrative of, oh, I didn't know that. So check this out. Vaccines in the news. We're going to go over some articles. This first one right here is Johnson & Johnson COVID-19 vaccine recipients often shift to other boosters. Now, this one right here was from the Wall Street Journal. And this was in November 26th, of course, just happened, 2021. I'm going to kind of go over this, but when I do, I want you all to pay attention because they're shifting. We're going to see why are they shifting. It's like I said, it's a narrative, and I want to go over it, and I want you all to see what's happening in the news. So right here it says, most people originally vaccinated with J&J shot are choosing other vaccines if they get a booster. New government data show partly reflecting concerns about the lower effectiveness of the drug maker's vaccine. Lower effectiveness of the drug maker's vaccine. Now, this is what they say. I'm going to continue to read, but I want you all to understand something. Now, so far, about 1.7 million people of the 15.7 million who originally got J&J's single-dose vaccine have received a booster. Of these, 26% stayed with J&J, so quite a bit, one quarter, for their second dose through Wednesday, according to U.S. Centers for Disease Control and Prevention. So that's the CDC, according to them. Then it says the rest of those originally immunized with J&J's shot later got boosters, received other drug makers' vaccines. Some, 43%, got Moderna. And 31% received boosters from Pfizer. Okay, now I want to explain my experience when I first got my shot. Okay, I got the J&J. But the experience was kind of weird. And I think I kind of see what's kind of going on here. So when we first heard that J&J was available to everybody, I'm not talking about the booster, the regular J&J single dose shot. I got word from my sister and her husband about, hey, it's available, and I'm looking at, okay, let me try to find one. So as I was looking, when we were going to like CVS and Walgreens and Walmart, we started realizing they were offering Pfizer, Moderna, no J&J. It wasn't readily accessible. So we had to keep digging, ask and it shall be given you, seeking shall find, knocking the door shall be open. So that's what we had to do. And you know me. I'm the type of person, I'm not just going to just let something go and just go with whatever is available. I'm looking for what I want. I was looking for the J&J, me and my wife. So we finally found a place that had it. So we had made appointments for the Pfizer and the Moderna, and we had to basically just cancel those appointments because we really wanted the J&J. And it was a convention center not too far away from here. And there were thousands of people, okay? I mean, I guess they had it laid out. And it was the National Guard out there, administering it and stuff like that. So what happened was they were offering also Moderna, but no one was really going for the Moderna. They were going for the J&J. And not to put race on it, but most of them were Caucasian, white. And you had some other nationalities in there and a few black. So we're in line waiting for our, J&J, and we finally got it. And I'm looking at what kind of experience should I receive, like what type of adverse reaction if there are going to be any. And this is what I've noticed. I noticed, like, not right away, but like a little later on, I think that same day, I felt a little fatigue. Like you're about to come down with something. Like, I guess it was like a 24-hour bug, because that's exactly how long it lasted. It was over with in around 24 hours. And I noticed there's some similar reports from other people. So no big deal, But this is what I heard. People, if you got the mRNA, now remember, we have 3 vaccines out there, 2 types of vaccines, but 3 companies. You have the mRNA, that's the messenger RNA, and you also have the adenovirus vector, which is the J&J, okay? 3 companies, but there are 2 types of vaccines. So if the people were getting the vaccines, the mRNA, and this is what the CDC said, they said, if you get these adverse reactions, I'm talking about like the severe adverse reactions from your first administered dose, do not get a second dose. I remember that. And I was like, whoa, so I guess be prepared for that, because, that's some good advice. You don't want to get the second dose if you get some adverse reactions. But I noticed that there were people, that I met, like, restaurant owners and stuff like that. They got the Moderna. First dose, no problem. But they got the second dose and they had the problems. They felt like they wanted to die. It was like terrible. That's what they tell me. And I was like, wow. So I've been hearing similar reports about the Moderna. And I was like, whoa. So, I guess you got to be careful, because when you get your first dose with the Moderna, it's like 4 weeks later, 28 days later, you get your second dose. And it was like very little room for error. You have to take it then. That's what they say. That's what the Moderna people say. Pfizer, a little different. After 3 weeks, that's 21 days, you take your second dose. And they had a little grace about 4 days. So that's how it works with the mRNA. And this is what pretty much every vaccine does. What you call elicits, that's ELICIT, elicit, that's mean to get an immune response. Okay? So when you get the vaccines, all of them, what's happening is your body goes into this rush mode of production of antibodies. And these antibodies are basically there to code and to be able to identify the so-called spike proteins and so forth of the coronavirus. Good. But what's happening is some, or should I say, they all have what you call a waning. Okay, keep that in mind. Waning meaning the waning of the antibody production. Some more than others. But as I continue to read this, I want you all to understand something. The rest of those originally immunized with J&J's shot and later got boosters received other drug makers' vaccines. Like I just said, 43% for Moderna, 31% from Pfizer. And we got the J&J, just to let you know, that's the first one. But then later on, we got the J&J booster, but it wasn't a walk in the park. Again, we had to ask, and it shall be given us. Seeking shall find, knocking, the door shall be open. So we're looking again, where can we get the J&J booster? So we're checking the CDC site, and it's not readily available. And my brother-in-law and different people were like, where is it at? And I'm like, I don't know. I'm trying to check it out myself, and it wasn't just readily available. And then I did a Google search, and I said, where is the J&J available? And then they said Walmart and Sam's Club. So I was like, okay. So I called Walmart Pharmacy, and they had it available through the prompts to set up an appointment to get your J&J, because not every Walmart has the J&J. It's still like this. When you call, I want to set up an appointment to get my booster. They say, okay, we have the Pfizer. We have the Moderna. They always do that. So I said, okay, I want the J&J. And they set up the appointment, and they gave me the specific Walmart that had it. Okay, moving ahead. We get to the Walmart, And there were a lot of people in line to get their booster shots. But we noticed that there were people in line who got the J&J shot, like couples and stuff. And then they're telling us, oh, yeah, we're here to get our booster shot. And so what you getting? Oh, we're getting the Pfizer. So that's what they tell us. We're getting the Pfizer. Okay. And I said, oh, we're getting J&J. They're like, we didn't know J&J was available. Yeah. Because a lot of people, they get pushed into getting the Pfizer or getting the Moderna. So it made me wonder why they said because of the lower effectiveness of the drug maker's vaccine. It kind of sounds like maybe that's all that became available because it wasn't easy to find it. Well, anyway, we got the booster. Oh, real quick, I want to tell you my experience with my second shot, which is the booster. So I get the shot. Before I get the shot, I'm letting the guy know. I said, hey, is there any type of adverse reaction I should expect? I mean, and then he tells me, he says, well, it said that it's more pronounced with your second shot. I was like, oh. So I'm thinking to myself, like, okay, give it to me. I need it. So he gives it to me. And it was kind of like, it wasn't. Let me tell you the effects, because, he gave me the shot. Okay, it was done. But the effects, I didn't feel that fatigue and all that other kind of stuff. And I was thinking like, okay, did I get a shot? Was it water or whatever? But I noticed a difference in how I felt. I felt more energetic, like more like a energy type of thing. I said, is that normal for you to feel energy and stuff after getting vaccinated? I don't know, but I took advantage of it. So I was doing more push-ups and stuff like that. But there was no adverse reactions for my booster. So that was like, that's good. Okay. But I noticed that a lot of people, and even my wife experienced this. One of the girls in line, she wanted to get the J&J too, but she didn't know it was available. And then my wife kind of hipped her to it. So now she's going to get the J&J. It's only basically either by word of mouth, or if you just that type of person say, I'm going to seek, I'm going to ask, and I'm going to knock, and I'm going to get it. Because not an average person going to do that. Now they're talking about people can mix and match. And I'm thinking about, okay, the mixing and matching, that kind of made me think about, okay, you have Pfizer, Moderna. They're similar because they're the mRNA. But if you mix and match with those, it seemed like, okay, it's the same product for the most part. But J&J, like I said, these people are going from J&J to Pfizer, Moderna. And I'm like, okay, is that okay? I mean, I guess they say it's okay, but I'm thinking, if J&J's booster shot is available, why wouldn't you just stick with the J&J? That's what I'm thinking. Okay, so here you have a J&J spokesperson. He says, the company's vaccine provides protection against symptomatic COVID-19, both as a single dose for an efficient response to the pandemic and as a booster dose. So they know their product. And I'm looking at it like, okay, why aren't we hearing this? It's not just, they're trying to sell a product. They're letting you know, hey, we made this as good as a single dose and for booster. Like, that's a really good, efficient way to go. And then, I'm not sure if everyone knows this, but the mRNA, their vaccine, it has to be ultra cold storage. You have to get 2 shots. Like I said, the Moderna, the first shot, then the second shot 28 days later. And there's no room for error. That's what I'm hearing. And then the Pfizer, 21 days later after the first dose. And then you have maybe a 4-day grace. Okay. But if you get the first dose and you get these crazy adverse reactions, do not get the second dose. That's what they said. But I'm hearing people who getting the first dose, no problem. But the second dose, and there's a problem. So, like I asked that one lady, the restaurant owner, I said, oh, so you had those reactions after the second dose? They said, yeah, I felt like I was going to die, Tony. Oh, it was terrible. I said, oh, you're going to get the booster? And she looked at me like, I don't know. So I'm hearing that people who got the Moderna, maybe they could go with the J&J or the Pfizer. It depends, I guess, on your situation. But I am hearing that there are a lot of different reactions from different people with not just one vaccine. There are 3 different vaccines out there, but there's 2 types, like I said. Okay, moving on. The preference for the latter shot was based in part on an unpublished study that compared boosting with various vaccines. The UK government didn't share the details of the study, but said the research provided good evidence that the Pfizer shot would provide a stronger booster response. You know, that's what they said. But I caught that. This was all based upon, or should I say in part, based upon an unpublished study. So I'm looking at, okay, where's your reference? Where you getting it from? I mean, you know, is this valid? Or do we just have to take it as holy writ, so to speak? And I'm thinking like, that's kind of like fruit of the poisonous tree, so to speak. You know, like you just injected some information and you don't have a reference, or no, you can't cite it because it's unpublished. And, oh, it's good. You can go with the Pfizer. The Pfizer's good. I mean, y'all had the AstraZeneca. I know y'all heard of AstraZeneca, okay? That's the other vaccine. Like you have the J&J is the adenovirus vector. AstraZeneca, adenovirus vector. But the thing is, they're from different sources. I'm not going to get into it right now, little bit later, but the AstraZeneca is in the UK. I would think they would be promoting their own kind. I don't know. I just thought about that. Okay, but getting back to that later. So it says the booster shots are intended to address waning immunity conferred by the original vaccines and to shore up protection from the highly contagious Delta variant of the coronavirus. Okay. Now, all vaccines have what you call a waning, meaning they go into your system, take some time to produce these antibodies. Okay. Now your immune system's on high alert. And basically they're coding for the baddies, you know, the coronavirus, to make sure that they can go ahead and have a fair shot at this thing. Because I look at it as this. When you get vaccinated, it's basically putting time on your side, as opposed to if you weren't vaccinated, time is not really on your side. Now you got to rely heavily on, or should I say solely, on your own immunity. And if your immunity is not up to par, time works against you. I've even heard of health gurus who weren't vaccinated and then they succumb to the virus and die. Yeah. Health gurus. I'm talking about healthier than me, like fit. So it just depends on your constitution. The vaccines put time on your side. All of them. Okay. So I'm not talking against one or the other or boosting one over the other right now. But later on, as we go through these documents, we're going to kind of see that the narrative is there. So if you look at this Delta variant, I noticed that when we had the novel, it was bad for all of us because, you know, we didn't have the vaccines. I was talking about all kinds of stuff prior to the vaccines. Okay. Now that we have vaccines, it gives you a level of protection that is kind of really good. I hate to say that, it just is. But what's happening is when you get the vaccine, yeah, there's a waning. I get that. But it's also a level of protection against these other variants, especially when you get boosted. When I first heard about the Delta variant, but first of all, before the Delta variant, I said, you know what? America, at the time when we had 200,000 deaths, I said, I see 600,000 easily. I saw that. And I was like, wow, that's about the same number that we had back in 1918 with the Spanish flu pandemic. I said, I see 600,000. Okay, we passed that. We're at 800 plus thousand. I heard about the Delta the first time. My wife told me. She said it's taking up about 20% of all COVID cases. That blew me away. I said, oh my goodness, because it's like twice as contagious and twice as virulent. And that means this thing is knocking people out. I was like, oh man. So I'm looking at it like, wow, 20% halfway through the week. I'm looking at the news. We're up to 50 plus percent. 50 plus percent of all new COVID cases. By the end of the week, it was like 93 plus percent. I threw my hands up. I said, I see this in my prediction. I see that we're going to have Americans not at 200,000 deaths, because that's around the time when I first started talking about this. Not 600,000 deaths. I see 1.2 million. And I saw that by the end of March. Now, that was when the Delta came about. Well, you know what happened. Just recently, we got Omicron. And when Omicron is not just 4 times as contagious as Delta, I'm not going to get into the virulent part, but the contagious part, very contagious. Because you know how Delta is. It's like in the lower respiratory area, okay? And you got to cough, sneeze, and things of that nature for it to be like a contagion, and people can contract it, okay? Omicron is different. Omicron is like this. It's in the upper respiratory. That means it's all in the sinuses. That means you can contract it through your nostrils. You can let it off through your nostrils just by breathing. Yeah. Now, y'all probably thinking, just by breathing Omicron? Well, you know what? Don't take my word for it. This past week, we seen it just go skyrocket everywhere. People getting it, and they thinking it's just like the common cold. We're going to go over that because it can be mistaken for the common cold virus. Moving on. The defections, meaning these people going from J&J to other vaccines. The defections from J&J's vaccine might partly reflect studies showing that it is less effective at preventing COVID-19 than the other U.S. authorized shots. I mean, might partly reflect studies. Is this the whole story? That's why I'm giving you all more information on this stuff. I said, I would think not. I think it's basically because it's being widely available. I mean, it's kind of hard to find the J&J. I mean, that's how I'm looking at it. Like when you're trying to get the J&J and then you're offered, here's Pfizer, here's Moderna. People are going to basically go along with it for the most part. I mean, if I wasn't so pushy, I would have probably went with it too. Okay. So it says one CDC study found the effectiveness at preventing COVID-19 hospitalizations in the U.S. was 93% for Moderna, 88% for Pfizer, and 71% for J&J. That was between March and August. Now, this is preventing hospitalizations. I'm not going to get into the numbers specifically right here because I want to show you all, like you can just Google efficacy and effectiveness. Okay. All these clinical trials were based upon efficacy. Okay. In fact, you don't believe me? Watch this. Okay, Google. Define efficacy.
Here's the definition of efficacy. Formal. The ability to produce a desired or intended result.
The ability to produce a desired or intended result. The ability. That means it's able. Okay? But effectiveness. Okay, Google. Define effectiveness.
Here's the definition of effectiveness. The degree to which something is successful in producing a desired result. Success.
Success. Meaning it can and it shall and it's done. That's what effectiveness is. It's effective. Efficacy, no offense, it's more like it has the ability to. Because, you know, when you do your clinicals and stuff, you're like, yeah, it has that ability. But is it effective at producing it? Is it effective at pulling it off? That's what I want to know. So let me finish this report because I want to show you all something. My video. It's not too long, but it's very informative. Okay, so also a study of mixing and matching vaccines showed that J&J recipients' antibody levels would get a bigger boost from either the Moderna or Pfizer BioNTech booster shots than from another J&J dose. Now, that's what they say. Okay, I'm just taking it, what they say. It says the study was sponsored by the National Institute of Allergy and Infectious Diseases. It's almost like I said before, when you get the shot, really any shot, but more specifically the mRNA, it's kind of like it puts your body in a high alert state. It elicits an immune response. That's what it does. And it might kick your body into overdrive for that immunity. You know, here's your B, your T cells, your neutrophils and macrophages and all your lymphocytes, everything is just going high alert. And then the antibody production, and we can code for the virus. So I'm like, bam, that's what it does. But what I'm looking at is if you're eliciting an immune response and that's it, and then you get this waning, you're going to need a booster later on. And that's what is kind of like the thing that's going on right now with the so-called Moderna and the Pfizer. I mean, they don't tell you this part. One single dose of the J&J, this is a fact. One single dose of the J&J, then they say it was 71%. Let's just call it 71%. Is more powerful, more effective than one dose of Moderna or Pfizer. That's not a lie, because you need 2 doses of Moderna and 2 doses of Pfizer to be more effective than 1 dose of the J&J. But now that we have the J&J booster shot, it goes pretty much as high as 90+%. I'm not going to bring that out right here, but that's what they're looking at now. But then you got to get a booster shot for the Moderna and the Pfizer to keep that immunity from waning, if I could put it that way. Yeah. So keep that in mind. You're going to be protected if you get a second dose of the J&J. We know that. I just said that. But you also might get a very strong antibody response if you go ahead and get one of the mRNAs. You might get a very strong antibody response. That's a response. Now remember, I'm not trying to knock the Moderna or the Pfizer, but I'm just saying their focus is eliciting an immune response. And you're going to hear that from time to time. And these are all the experts. That's what it does. Put it in a high alert, your body, which is good because you kind of need that. Okay, especially against this pandemic. So what's happening is you have this eliciting this immune response for the Pfizer and the Moderna. And if you get the Moderna or the Pfizer, if you had the J&J, it'll be a stronger antibody response. That may be true just because of the nature of the mRNA. Okay. And it says, referring to the messenger RNA, the key component of both Pfizer and Moderna vaccines. It says Mathai Mammon, head of research and development for J&J's pharmaceutical unit, said it is difficult to draw firm conclusions from the NIAID sponsored study about the J&J's booster. He's trying to back up his booster. Hey, it said the study tracked the effect of booster shots on antibody levels, but not on other elements of the immune system that J&J's vaccine might enhance. Did y'all catch that? Enhance. Pfizer and Moderna ain't saying that. They ain't talking about the enhancement of your own immunity. They're talking about boosting your antibody production and getting your immune system on high alert. But remember I said the waning? Well, when J&J's wane, it kind of left you a little special surprise, an enhanced immune system. Now, I'm just saying this is what he said, okay? It says, for us, the data are not mature, he said. So, like I said, you got this in eliciting an immune response with the Pfizer and Moderna. I'm going to keep saying it. And then you have J&J basically saying, hey, we can enhance. See, the vaccine enhances. So you got the immune system do what it's supposed to be doing, which is supposed to basically fight the baddies on its own when the vaccine is basically waned. Okay, keep that in mind. A separate J&J sponsored study showed that giving a second dose of its vaccine about 2 months, okay, that's 8 weeks, 2 months after the first dose was 94% effective at preventing symptomatic COVID-19 in the U.S. That's mind-blowing because that's what I'm talking about. I'm not talking about just hospitalizations, like preventing the hospitalizations. They said preventing symptomatic COVID-19 in the U.S. I don't know if I know what that means, but you got them basically saying that Pfizer and Moderna can prevent the hospitalizations and, the death too, prevent the death, but prevent the hospitalizations. Well, let's go one step further. What about preventing symptomatic COVID-19? Pfizer and Moderna ain't saying that. That's what I'm trying to tell y'all. It's like give us the other side of the story. Maybe if you give us that side, then we can make an informed decision on what we would like to use or get, because if yours is about preventing me from being hospitalized, I say, yeah, great. But if you preventing me from getting symptomatic COVID-19, I'm like, I might want that one. That's something to consider. Safety considerations might play a role in booster choices, according to doctors and researchers. A rare but serious blood clotting condition. Now, this is the part that I think we've all been hearing about the J&J. It says a rare but serious blood clotting condition has been reported in a small number of recipients of the J&J vaccine, primarily in women younger than 50. U.S. health authorities say that the benefits of J&J's vaccine outweigh any risk. Let me read that again. U.S. health authorities say that the benefits of J&J's vaccine outweigh any risk, including the clots. But the women under 50 should be aware of the risk as well as the option to get other vaccines. That's fair. I'm looking at, let me know about them clots. Let me know who's at risk. But then if these U.S. health authorities are weighing it all out, it said, hey, it says it outweighs it. Like, let's go with this. It's not a bad thing. And I'm thinking, what health authorities? Because the CDC is not talking about that. And I'm going to show you all some stuff. It's kind of weird. So maybe it's the National Institutes of Health, maybe. I don't know who else is saying it because they're not saying who said this. But maybe they're the smart people and they're thinking, we better put this information out there so people can be aware that, you have other options. If you look at what you have with J&J and you look at what you have with Pfizer and Moderna, you're looking at all the vaccines are good. It's just that there are areas of the vaccine that you need to be concerned with, because when they're talking about this clotting, they're talking about like a thrombosis type of episode, or maybe even more specifically thrombocytopenia. Okay, that's where you're dealing with blood clots and stuff. But what if you're not prone to that? Then you're not really at risk. But I still like to know those risks. So it's good that you put it out there and let people know. Okay, so it says, Dr. Like said, some women might feel more comfortable choosing an mRNA-based shot for their booster because those haven't been associated with the increased risk of the rare clotting condition. And that's fair. I think we need to know that we have options. It says they can have a little more peace of mind if they want to switch to mRNA, she said, if that's the case. But I just told you all earlier, I knew people personally had some adverse reactions and they felt like they wanted to die. So I don't know. It's kind of like, I just want to give you all the good, the bad, and the ugly, and make y'all, y'all can have a more informed decision when y'all choose whatever vaccine you want. It says, conversely, some young men, now this is important, some young men who originally received a Pfizer or Moderna vaccine might choose to get a J&J booster dose because of the mRNA shots have been associated with an elevated risk of heart inflammation conditions, including myocarditis in males under 30 years old, Dr. Like said. And you can ask Google about it. It's basically the inflammation of the inner walls of your heart. That don't sound too good. And if you're at risk because of the effects of the mRNA, you want to have that option to go with J&J. See what I'm saying? So let us hear all the risks. Women, the risk, the men, the risk, and then we can all make an informed decision. It's that the U.S. health authorities, I still think that might be the National Institutes of Health. I'm not sure. But it says the U.S. health authorities say any adult 18 years or older who has first vaccinated with J&J single shot should get a booster. of any vaccine at least 2 months later. Okay. They have also said that any adult who received the original 2 doses of either the Pfizer or Moderna vaccines may get a booster at least 6 months after the second dose. Okay. So let's keep that in mind. But this was talking about people are shifting from J&J over to other vaccines, okay, like the mRNA. But I was saying, why? So look at this. CDC recommends Pfizer, Moderna vaccines over J&J. Now this is a CNN report. And I was just thinking, maybe that's why. Because that's why I said certain things are being said by certain health authorities. Now, the Centers for Disease Control, we're talking about the CDC is saying this. They recommend Pfizer and Moderna over J&J. And I'm like, what? I said, I got to read this. So this is the other report. And as I'm going through these things, we're going to have, different videos, and we're going to have what you call different parts of this, because I know people's attention span is only so much. But I just wanted to paint the picture of there's something going on here and you're not hearing about it. Okay. So what are they saying? They're saying that they prefer these other 2 over Johnson & Johnson. That's what the CDC says. Okay. It says the new recommendation, the mRNA vaccines are preferred over the Janssen pharmaceutical one, and for prevention of COVID-19 for those 18 years or over. So that's what they say. Okay. Then it says, let me read this part. Early Thursday, the CDC's Advisory Committee on Immunization Practices endorsed the updated recommendation after hearing new data indicating that a rare blood clotting syndrome is more common among people who recently got a J&J vaccine that previously believed. It's a CDC director, Dr. Rochelle Walensky, accepted the updated recommendation within hours. So it's like they jumped on that, okay? It says the CDC has logged 54 cases in the U.S. for thrombosis. Okay, that's that blood thing. Okay, with thrombocytopenia syndrome, or TTS, in the U.S. since the vaccine became available. It says 9 people have died, 7 women and 2 men. I remember when the first reports came out, it was 7 people altogether. I think it was 6 women and 1 gentleman. Okay, so I guess they went up 2 more. Now remember, this is a rare event. And I'm picking up that if you have, or should I say, if you are prone to thrombocytopenia, then this is something that maybe you might want to check with your doctor before you get any vaccine. Okay, just something to consider. It says rates are higher than previously estimated among both men and women, the CDC's Dr. Isaac C. told the meeting. It says, while only a few cases have been seen for every million people vaccinated by age group, they are higher than what was believed when vaccine advisors were last briefed. Okay. It says, we've been struck on reviewing these cases by how rapidly a patient deteriorates to death. Okay, so basically it said within the 9 days. 39 of 54 reported cases occurred before the CDC and the U.S. Food and Drug Administration paused administration of the vaccine in April to investigate the link. Okay, so in case you all didn't know this, when they had the initial rollout for the J&J, everybody was jumping on board. I told you, like, even when we went, it was a convention center, it was like thousands of people. And I'm saying, wow, everybody's about to get vaccinated. But they put the brakes on. So the CDC basically said, whoa, so I guess the government said no more J&J because people are getting blood clots. And I'm thinking to myself, like, how many people? How many people? And then I found out later on, and I'm gonna read this later. They found out that it was like 7 people in total, 6 women, 1 man, like I said earlier, out of over 1 million vaccines. And then I'm thinking, okay, but why? Is it just because you're a man or you're a woman? Or maybe you're prone to it. Now, that's possible. But they're not putting it out there like that. They say, oh, it's blood clot situation. Okay. And I figured that was kind of irresponsible because, like I said, the other agencies, they said they outweigh the risk, even with blood clots. That's what they said. Okay. So it says the rates are now slightly higher, like they said, for all age groups, he said. The highest rate of TTS is among women, 10 per million vaccines given in women ages 30 to 39, and 9 per million in women ages 40 to 49. I'm sorry. That is so insignificant. And somebody said, oh, you shouldn't say that. Every life is valuable. I know that. Look at all of the drug companies that sell their stuff on TV. And every time you hear any drug out there, they always say, oh, maybe bleeding rectum and, you might have suicidal tendencies and even death. I'm just saying. And those are more common. But here you're talking about 10 women out of a million. A million. I mean, some people may want to roll the dice on those odds and say, hey, I'll go with that. Or at least I'll be protected because it might not be me. But they're not telling people that. They just say, oh, this is bad. Then it says the overall risk of developing TTS is 3.8 cases per million doses given. Again, real small number. It says the death rate is less than 1 per million doses given. That's 0.57 per million. And we're going to set the alarm. Oh, J&J's bad. I'm just saying. But let me tell you this real quick. Let me see if I can tell the story quick. So we were taking care of my mom-in-law, okay, over here at my house. And my wife was taking care because she's doing the home health care. But then there was a nurse coming just to check on my mother-in-law. And then somehow the conversation came up about, getting vaccinated and stuff like that. And my wife had mentioned that, she got the J&J. And then the nurse was like, oh, like looking at her all sad and like, oh, that's so sad. Like, bad, this J&J's bad and stuff. And my wife, she's all, pure-hearted and stuff and just being all cool. And I was like, if that was me, because I overheard it. I said, that was me, I would have been snapping off. Like, how dare you? Put this fear in me about my vaccine choice. I'm like, and you don't know anything. It's important what I'm about to say. I really like this guy. His name is Ari Melber. He's on MSNBC. It's called The Beat with Ari Melber. He said something that I will never forget, and I took it to heart. He said, know what you know and know what you don't know. And he said it to somebody, and he kind of baffled him with him. But he had to break it down. He said, know what you know. In other words, do your research, study to show yourself approved, here a little, there a little, rightly divide a word of truth or facts, and know what you know. That's what I do on the show. I know what I know. And I know what I don't know. Meaning, I don't know everything. Like somebody say, oh, can you fly this plane? No, because I don't know how to fly a plane. I'm just saying. Can you perform open heart surgery? No, because I don't know how to perform open heart surgery. But some people put so much stock in just people in general. Like, the health gurus or the pastors or whoever. And, they might say something and they, oh, he said it. It must be important. And a lot of times it just be stuff that they don't know. But then they'll act like it's holy writ. That's why we got to be very careful when we talk to people. Our words are very powerful, and our influence carries very far, especially to young and naive. I mean, not everybody's naive, but I'm just saying some people are. And you got to really think about what you say and what influence you have over people. So think about that. Know what you know and know what you don't know. And I'll go one step further. And if you don't know something, don't act like you know it, because you don't. Okay. So moving on. It was an updated CDC recommendation follows similar recommendations from other countries, including Canada and the United Kingdom. Now remember, in the United Kingdom, you have the AstraZeneca. It says, given the current state of the pandemic, both here and around the world, the ACIP reaffirmed that receiving any vaccine is better than being unvaccinated. That's what it said. It says individuals who are unable or unwilling to receive an mRNA vaccine will continue to have access to Johnson & Johnson COVID-19 vaccine. Yeah, that's good. It said the ACIP also discussed the risk of completely removing J&J's vaccine as an option, as well as the potential confusion and mistrust that might be caused by changing recommendations about the vaccine. We will absolutely emphasize how important education around the risk of these events is, Oliver told the meeting. It says the VE, the vaccine effectiveness, is lower for the Janssen vaccine compared to the mRNA vaccines, Oliver said. Now, I'm just saying this is what the report says. So let's just take it as a grain of salt. It says the risk of myocarditis, that's that rare heart inflammatory condition, is lower for Moderna and Pfizer BioNTech vaccines than the risk of blood clots from J&J's vaccine. That's what they say. I'm just giving it to you how they say it. It says, but younger men may be advised to avoid mRNA vaccines. So if they're advised to avoid these mRNA vaccines, why are you putting a number on the risk factor? Ooh, J&J is more riskier than the mRNA. But if you're a young man, don't get the mRNA, get the J&J. That's what they're saying. So it's kind of weird how what they're saying, like I'm reading between the lines, I'm like, they're all risky to a certain degree, to a certain degree. Now, it says, so Oliver said that complete removal of recommendations for the J&J vaccine would cause problems. So people were talking about the J&J real bad, but now they found out that the mRNA has some issues with young men. They say, whoa, if we take away the J&J, then these young men may be more at risk. Can you imagine they get a booster? They may have this myocarditis, this inflammation in the inner walls of their heart. That's bad. We better have that option. J&J, stay around, please, because young men will be mad at us if they don't have that option. I'm just saying. Now it says, plus the Janssen vaccine, which is the Johnson & Johnson. The Janssen vaccine is often the only shot available for prison populations, the homeless, and other high-risk groups. So you got to kind of keep that. And like, look, I said that about the mRNA. Ultra cold storage, you got to have 2 doses. I'm talking about to be so-called fully vaccinated. You got to get them spread out over time, the right interval. Moderna, 28 days, no room for error. You got to do it. That's what they said. And then the Pfizer, there's a little room. You got 4-day grace, but 21 days. Johnson & Johnson, 1 and you're done. That's the Johnson & Johnson. 6 months later, get the booster. Boom. Your immunity goes up 94%. Boom. You're like, well, okay, so why are they getting on J&J's case? Because they got the myocarditis issue. I mean, that's what they said. That's what the experts saying. But they said, well, our myocarditis issue is not as bad as the J&J's clotting issue. And you know what? They all risky to a certain degree with certain groups of people. Let's just call it like it is. Let's give them the good, the bad, and the ugly. But if you are generally healthy, you really don't have too much to be worried about, I guess. But it's something to consider anyway. You need to hear this information. It says, plus, you're going to eliminate the people in the prison, people in the homeless people, nursing homes and everywhere else for that matter. I mean, I don't know how widespread the Johnson & Johnson is, but I see it can be the one of choice because it's one and done. You don't have to wait so many days. You don't need ultra cold storage. Just something to think about. Okay. So it says earlier this week, the FDA strengthened language in the fact sheet that goes along with Janssen vaccine, saying it should not be given to anyone with a history of TTS. That's that thrombosis, the thrombocytopenia thing. If you had a history, they said, hey, it shouldn't be given to you. It says, there is, however, no clear risk factor for predicting who will develop the condition after getting the vaccine. Let me say it again. However, there is no clear risk factor for predicting who will develop the condition after getting the vaccine. That's what the CDC say. So basically, it's not something to be concerned with if you're not prone to the TTS. Now, if you're prone to that, my advice to you is you need to check with your doctor and say, hey, I want to get vaccinated. I mean, I want to get, let's say you want to get J&J. I want to get J&J, and I need some recommendation. And the doctor going to be like, you know what? If he don't know, he'd be like, you need to talk to your hematologist. Now, you talk to the hematologist, blood doctor, he's basically going to let you know if your numbers are good. And you're a candidate because your blood is okay. Or wait a minute, we might have to think this or rethink this and then give you the right recommendations. So you must check with your doctor before you actually getting any vaccine. That's what I think. Okay, so this whole process should increase confidence in our vaccine safety and surveillance system. Dr. Sandra said, I do think this vaccine needs to be made available. She said, we need a variety of vaccine platforms. So, we're getting it from everywhere. It's something to think about. And then the last thing, it says, Dr. Penny Heaton, global therapeutic head for vaccines at Janssen, told the meeting the J&J vaccine is unique. This is important. We are confident in the positive benefit risk profile of our vaccine. It is saving lives in the U.S., here today, and on every continent around the globe. Our vaccine is different. It's long lasting. It offers high levels of protection, and it offers breadth of protection. Heaton told, the meeting. It's easy to store and transport. Heaton said the J&J vaccine provides a different type of immunity that grows more slowly, but lasts longer. Did y'all catch that? So yeah, you're not getting that we're going to elicit an immune response like, Pfizer and Moderna. It's more like you're going to get an immune response, but we got something for you. It's going to grow more slowly and last much longer, the effects. Okay. So that means this vaccine is kind of like a smart vaccine, if you want to think about it like that. Something to think about. It says even in the U.S., given its durable protection, it may be the preferred choice for people who can't or won't return for multiple vaccinations, Heaton argued. She said the company has several studies underway to understand risk factors for TTS. Now, see, this is weird. If you get your first shot of the mRNA, you don't have as much protection as one shot of the J&J. That's a fact. But there's a lot of people that's not getting their second shot for the mRNA. I'll go one step further. And there's a lot of people that's not getting their booster who had the mRNA. I just gave you an example, like someone get the second shot of the Moderna, and they're like, I don't know about that booster because of those effects. I ain't heard of those crazy effects with J&J. I mean, heard maybe like the 24-hour bug type of thing, but not like, oh my goodness, I want to die or I feel like I'm about to die. I've been hearing that, not just with her, but different people feel like you want to die. I'm like, what is that feeling? That's crazy. Now, I think we just all need to hear this, the good, the bad, and the ugly of all of this stuff. The good is all the vaccines are effective. Let's keep it like that for a moment. Yeah. So I want to not keep reading things and reading reports. I want to show you something because remember, I just went over efficacy. It's basically the ability, but effectiveness is success. Okay, that's the difference. But look at this.
When Pfizer first reported the efficacy of their COVID-19 vaccine, a staggering 95%, many thought that would mark an end to the pandemic. But that hasn't happened. Vaccination rates have remained low in certain parts of the world despite multiple available vaccines. And there's also been reports of breakthrough cases where fully vaccinated people get COVID. And now, recent unpublished data from Israel showed that the Pfizer vaccine was only 40% effective at reducing the risk of symptomatic COVID. So, if the original trials showed high efficacy, why did a large portion of people in this Israeli study get COVID? Here's why those two numbers are so far apart, and why neither of them can tell the full story. To understand this gap, first you need to understand the difference between efficacy and effectiveness. Vaccine efficacy refers to how well a vaccine performs under ideal, tightly controlled conditions like clinical trials. For example, during trials for COVID-19, vaccines were given to people on a tight schedule. It also has to do with what the researchers were studying. Here, they were looking at how well vaccines prevented symptomatic infections in a limited number of people, not whether they prevented infection altogether or kept people from being contagious. And with COVID-19, it's possible to be infected and not show symptoms.
What determines how efficacious or how well the vaccine works in a trial is really two things.
Lisa Lee has studied the spread of viruses for 30 years and has held leadership roles at the CDC.
It's how contagious the virus is, how many people an infected person might infect if in the absence of a vaccine. And it also depends a lot on the host, that is people. How well can the vaccine stimulate the right immune response for people?
In Pfizer's study, the company tested about 44,000 people for symptomatic COVID-19, and only 170 developed the disease with at least one symptom. And of those, just 8 had been vaccinated, while 162 had gotten the placebo.
Keep looking at this. This is important. Okay. It said it was over 40,000. Let's just keep it real. Over 40,000 candidates for this study. But only 170 had the symptomatic thing. And of that 170, only 8 people got the vaccine. And the other 162, I think that was, got a placebo. That's how they did their so-called clinicals. Now, I bet you a lot of people didn't know that. And I'll go one step further. These were not what you call your average, everyday, run-of-the-mill Americans. You know, people who have chronic conditions and things of that nature. No. These are people they chose for the study. Now, it might have been, what is one of the symptoms? Now, I'm not saying that this is what it is, but one of the symptoms could be fatigue. One symptom, fatigue. It could have been. I mean, I don't know what other symptoms they are that they would have used, but we don't know how the study was so accurate. 90+% efficacy. But in Israel, they did it. They said, man, we got 40% out this. Now, a lot of people didn't know that. I mean, I'm glad I'm giving people the good, the bad, and the ugly, because people need to see that. Now, some people will accuse me of saying, "Oh, you're splitting up the country. You're causing division." I'm like, no, I'm trying to give people the other side that you're not getting, so that you can make an informed decision and say, you know what, I'll make a choice and I'm gonna choose it because of me, not because somebody telling me to. Because I know some people say, "Oh, I don't want to take the vaccine because they're trying to force it on you and stuff like that." They ain't trying to force the vaccine on people. No. If anything, they should have a mass mandate. But the forcing of the vaccine, I'm looking at it like this. If you are not vaccinated, okay, because you choose that you don't want to be vaccinated, you do you. But you do you not around me. That's how I feel. And I know a lot of people feel that way. Like, yeah, you might not be vaccinated, but you are being irresponsible. And you around me, my family, my friends, and my colleagues, and whoever else for that matter, and you spreading your COVID love, if I could put it that way. I don't want to be around there. And then some people actually say, hey, I am fully vaccinated. Here's an example. I'm not going to say the restaurant. I went to the restaurant, and I think it was the manager, because she was dressed differently. And it was a patron that came in, no mask. She says, you got to wear your mask. He's plastered all over the wall and everywhere. Okay. He said, well, I've been fully vaccinated. That's what he said. And I was like, I ain't going to get into this argument. But I just thought about it. I said, wait a minute. She's not wearing a mask. I'm sorry. I had to say something. I said, you're not wearing a mask and you're telling him to wear a mask. She said, I wear a mask when I have to. I'm like, that's your answer? I'm sorry. I called corporate. I had to. So then, shortly after that, I think a couple of days later, everybody up in there was wearing a mask. I'm talking all the employees, including that person. But there was another situation, another restaurant. I'm not going to say the name. I'm up in there. Now, I saw some patrons not wearing a mask. They weren't even, paying them no mind or nothing. But then there was one manager. And I don't know, I just happened to have my phone on me, I was just thinking about having my phone, and I was, trying to take a picture of her not having a mask. And then it dawned upon me, they were clocking me. And then somebody approached me. Oh, no, she approached me. She said, she's the manager. She said, you can't have any media and stuff like that up in here. And I was like, oh, okay. And I turned it off. But then what happened was, I said, I noticed that, you're not wearing a mask, aren't you supposed to have? No, I said, aren't all employees supposed to be wearing a mask? She said, yeah, all employees supposed to wear a mask. I said, well, you're not wearing a mask. I'm wearing a mask. She had it down here though. Okay. I was on her chin. And I was like, I wasn't going to argue with her, but I was just wanting to know, like, what's your reasoning? She said, almost like the other person, I wear a mask when I have to. That was her response. And then she wanted to keep talking. I said, I'm done. Like, you do you, but not around me. I had to call corporate. Right? A couple of days later, I come up in there. And then I saw this gentleman. And I asked one of the employees, I said, hey, is he the manager? Like a regional manager or something? I said, no, he's the owner. I said, he's the owner. I said, I gotta speak to him. Get him over here. So then he went in the back. I guess he was walking real fast. The owner was walking real fast. He comes back to the front, and I'm talking to the owner. I said, sir, some of your employees, mainly a manager, wasn't wearing a mask up in here. He was really pissed. He said, what? We have zero tolerance for that. You got to wear a mask. You got to wear gloves. I was like, whoa. Who was it? I was like, who was it? I said, I don't want to get nobody in trouble. But he kept insisting. So I said, it was just one of the managers. One of the female managers. So he was like, Like he was kind of like trying to figure out who it was. I said, I don't want to get nobody in trouble though, man. And then he said, no, we can't really control any of the I'm sorry. We can't really control any of the patrons, but hey, the employees, they got to comply. And I said, yeah, I understand. He said, what you want? I said, I don't know. He said, whatever you want, here, you can have it. And I'm like, I'll take one of those. I ain't gonna tell you what it is. But he said I can have one. And they were reluctant on giving it to me. I mean, this is the owner. He's like, I want something, Okay, they gave it to me. I was like happy. But at the same time, I was also happy that I did that. Because I'm thinking to myself, like, why are these people walking around with no mask? I don't want to say this real quick, just so people will get it in context. Why are people not wearing a mask? Why are you not being in compliance? So you're obviously being defiant. The Bible says, let your light so shine that all men may see your good works. So they see you, even before you getting approached. And I'm thinking, are you not wearing your mask because you don't want to let your light shine? Or are you not wearing your mask because you just want to have a proud look? And I thought about it, like, that's gotta be it. And you think God likes that? No, I talked about this on the show all the time. This is one of the things God hates, a proud look. Now people say, not wearing a mask is a proud look? No, not wearing a mask during a world crisis pandemic is a proud look. Let me explain. So I'm thinking, you got a lot of people out there, they do public speaking, okay? So I was invited to do some public speaking. And I'm, preaching, the word. And I'm up there with a mask. Not like this. You get up there with a mask and then you start speaking at the podium with the mic and you take it off. No, for the whole sermon. Matter of fact, you don't believe me? I got it on my channel. The whole sermon with a mask. I only seen 2 people through this whole pandemic wearing a mask while doing some public speaking. I ain't talking about for a few minutes and then you decide, I'm not wearing this mask. No, I'm talking about for the whole sermon. Moi, and this one woman, I don't know her name, but I said, wow, she's like me. She wore a mask for the whole sermon. It's on YouTube, but I ain't seen nobody else wearing no mask. I guess they don't understand how COVID works. It's airborne. Hello. So I'm thinking, okay, if you stand up at the podium, worldwide pandemic crisis, and you're gonna basically just stand up the podium, I keep saying it, you're standing there because you're about to speak, and everybody sees you speaking, and you don't have a mask on. That's gotta be a proud look. Because I'm looking at it like, everybody I see that get up there with a mask, they take it off. I ain't wearing no mask. So what are you showing your congregation? You showing your congregation you ain't got to wear no mask, even though you should wear a mask. Now, people say, oh, you ain't going to get no COVID. I heard people come up to me at the church and stuff and say, oh, we're blessed of the Lord. I'm like, you fool. I'm thinking to myself, like, that's how you think? You know how God works. He says, I'm not mocked. Whatsoever man soweth, that shall he also reap. We should all know that. I don't know why people thinking that they got a special thing with God. Remember, he's no respecter of persons. This is all biblical. But for some reason, people can't get it to their thick skull to think that, wait a minute, I don't have it like that with God. If he don't have it with his own son, he had to die. There's no remission of sin yet for the shedding of blood. He had to die. You think Jesus is going to say, hey, you know what? I ain't doing that. I'll do everything, but I ain't going to do that. No, he said, I'm going to do that because I love you. Now, why can't we have the same attitude? Let our light so shine that men may see our good works. Our good works is that we're going to be responsible. We're going to wear a mask. I was at the podium. I'm preaching. And I'm thinking to myself, like, man, what if my voice is muffled? So I did this. I'm thinking, can y'all hear me? Man, pretty much almost everybody up in there said, yeah, we can hear you. I'm like, whoa. You don't believe me? It's on that video. Came. Oh, I'm sorry. Can you do this a little bit more? Right here. I don't hear myself. Oh, you can hear me? Yeah. I wish I had some monitors right here. Okay. And I'm thinking like, wow, so there's no excuse. Unless when the minister gets up there, he said, wait, my voice ain't that powerful. I can't wear a mask because I got to project my voice. Hello, it's a microphone. Turn it up. You got your crew, turn it up. They didn't turn it up. Well, I did ask them to turn it up, but it was the same volume. It's just that you speak clearly, loud and clearly. And I'm thinking, why they can't do that? Why can't all the other ministers do that? Oh, you're just so special. You got to be all special, Tony. I'm like, I'm not special. I'm looking at it like, hey, I'm in compliance. You're in defiance. Defiance, proud look. Now, I've heard of stories, ministers getting up there, preaching, end up with COVID, spreading it to their congregation, and some of them even die. I'm not stupid. I wasn't born yesterday. I know how this thing works. It's a smart bug. I said it before, and I'm saying it right now. Let's check out Omicron for one moment. And my sister, she gave me something to think about. She said, if you got to be 6 feet for the novel, maybe you might have to be possibly 10 to 12 feet for Delta. Is that like you got to be about 20 to 30 feet for Omicron? And I was like, I didn't think about it like that. I talked about a whole lot of stuff on this show, slipstream and things of that nature. And I said, oh man, and it is airborne. Remember, one choir person member gave it to 52 people. One. And that was the novel. We're dealing with all kinds of variants right now. I'm thinking, wow. So why would we think it's okay to come out in public amongst people with no mask? I had one guy come to my house, and I said this in my sermon. He comes to my house because he's supposed to repair my so-called AC. And he had his mask down here and up here. I could see his mouth. I could see his nostril. Now, how is you're going to come to somebody's house and disrespect me? I said, it's my house. I said, you need to put your mask on. This is my house. He put his mask on. No problem. Sometimes you got to check people. I had one guy come to my house yesterday. Yeah, my AC went out. It happens. Okay, so the repairman's coming out, comes to my door, right? And I'm seeing him, and I'm like, whoa! He comes with a mask on, but it's like this, just for example purposes. Now I'm saying to myself, like, whoa, I said, no, you gotta wear your mask. But I'm thinking, why do we gotta ask people to put on their masks? It should be like, you know what, if I'm coming to an establishment, I don't want to breathe your air. We in a pandemic. It should be just that simple. I get it. Some people just want to say, you ain't got to wear no mask. I have nephews and stuff. Oh, you're not wearing a mask now, huh? I'm like, I don't get it. But I'm looking at, you got too many people out here that just being defiant. And I keep looking at this pandemic and how it's spreading because of, I hate to say it, stupidity. Remember, it's a smart bug. So with a smart bug, and I said this before, smart bug is spreading his love, and how's he doing it? You're coughing, you're sneezing, you're singing, you're talking, okay? And that's how Delta spread, because it's in the lower respiratory. But what about Omicron? Oh, Omicron is spread a little different. Really? I'm giving you all the good, the bad, and the ugly. Omicron is spread in the upper, through your nostrils, just by breathing. I said this earlier. Just by breathing. So you're in a room with people and you're breathing. Most people breathe through their nostrils and you're spreading it. Omicron might be a little less virulent, but it's highly contagious. 4 times more contagious than Delta. Yeah, Delta may be more virulent, but Omicron is taking people out, especially the unvaccinated. And my heart goes out to them, but you're putting a big burden on our healthcare system. Can you imagine going to the ER because you have shortness of breath or you're just hard of breathing? You think they're going to see you first? There's been people for other conditions that are not even COVID related, got to sit 12 hours in the ER waiting room. So what makes you think you're special when you have so many other people who have been vaccinated and trying to be responsible, and then they go ahead and go to the ER? They're going to see first come, first serve, or based upon, the prioritized system. I mean, I'm not trying to knock people who are not vaccinated. I'm just saying that you're unvaccinated and you're putting other people at risk, and other people are there trying to get their care, and they have medical or episodes or whatever, and they got to be taken care of too. So doctors have to prioritize. Insurance companies have to prioritize. I'm hearing that insurance companies are dropping people who are not getting vaccinated. So they got a lot of things to think about. I hear all kinds of stories. Oh, it's the mark of the beast, or it's other different things that's going on with this so-called COVID. No, the vaccine. See, they ain't talking about the COVID no more. They're talking about the vaccine. Vaccines are bad. If they're so bad, why is it that people who are vaccinated are not dropping like flies, and people who have not been vaccinated are dropping like flies? Now, people who have not been vaccinated, Omicron is here, and people are getting Omicron, and they're thinking about it's like the common cold. I'll be all right. I got something for y'all. This is going to be different parts, and I'm going to put them out accordingly and then just continue this thing going on. But we're going to get back to this video because it's still enlightening, encouraging, and empowering to let us know that this thing is real. We got a pandemic, but these clinicals, y'all need to know. I said it before. 170 out of 40,000 plus people who had symptomatic. I don't know what that is. I don't know what that means. I'm not going to try to spell it out exactly, but only 8 people of that 170 got the vaccine, and the other 162 got a placebo, and they come up with this 90+ efficacy. Let's continue.